Thank you, Marty. I'm very grateful to be here today to present the activities that we're doing at Gold Coast Health in relation to choosing our pathology testing wisely. My name is Therese Kelly and I am the Project Manager of the Choosing Wisely Pathology Project at Gold Coast Health. I'm also joined in the audience today with Robert Trethui, who is the data analyst in our project, and he's been responsible for developing some of the really cool tools for our project. Also, we have Tony Gent in the audience, and he provides a lot of pathology advice and specialist advice for us in the project. So I'm just going to give a very quick overview of the slides that I'll be sharing with you today. In terms of a background, as you may be aware, there is a national trend where public laboratory workload is increasing annually between 5 to 10%. And this has really been verified by the National Coalition of Public Pathology in their 2012 report. And really the same is the case at Gold Coast Health too. We were experiencing the same increase in public pathology testing, both in test volumes and the spend. And I think it's true for a lot of other health services in Queensland and also Australia. So I suppose in response to this, our organisation decided to set up a dedicated project. We started in January 2016, January last year, and we've been running for about 15 months. But we really wanted to, I suppose, we had a desire to provide better value care for our patients. So, and we wanted to see, are we actually choosing pathology tests wisely? Now, wise testing choices comes with challenges around how to define what is appropriate. Is it overuse or underuse? Is it initial versus repeat testing? So when is it appropriate for a test to be repeated? Is it the clinical setting or is it the patient pathway? So at what stage of that clinical flow should tests be ordered? Is it about the ordering clinicians or is it really the specialties or services? So are there some particular clinicians who actually favour certain tests compared with their colleagues, or are there specific tests favoured by specialty areas? But basically in our project we're trying to look at all of these variations. So very early on we actually aligned ourselves with Choosing Wisely Australia because we were really attracted to the principles of promoting conversations about the appropriate use of tests, treatments and procedures. Actually, Gold Coast Health was the first health service in Queensland and Australia to join the Health Services Pilot Program, and that's now grown to include many other health services in the country, and some of whom will be sharing their experiences in this session. And actually on that note, I did want to acknowledge the vision and commitment shown by Choosing Wisely Australia and NPS Medicine Wise to firstly host this important national meeting and also to support health services such as ours. So in terms of our strategy, our broad objectives in this project are really to assess the current state of pathology use by specialty and service area. So we're really looking at test volumes, retest intervals, maybe day of stay testing, preoperative bloods, those types of things. And once we understand the use within a particular specialty, let's say for instance gynaecology, we work with those relevant lead clinicians and pathology experts to determine the clinical appropriateness of the pathology ordering patterns. So it's really about shining a light on what pathology happens on the floor and in the wards so that clinicians can understand those interactions through the entire patient flow. So for example, knowing what tests happen when a patient arrives at ED. If they get admitted to a short stay area, what are the tests that happen there? They may then go further into a longer stay inpatient area. They may go to surgery and then they come back post-discharge in an outpatient setting. So we actually can capture all of those pathology transactions. And then the clinicians themselves identify opportunities to change or reduce pathology ordering. So then we move into that next stage of developing demand management strategies to improve their ordering practices. And obviously central to our whole strategy is our goal to improve patient safety and experience. So what are the benefits of this project? Well, there are many, but really our main driver is to improve quality and safety for our patients. And we are realising this by ensuring they aren't having unrequired or unnecessary tests. And that can actually then lead on to other unnecessary interventions and so on. Another benefit is the education and learning values that we gain through this process. we're making sure that we actually are keeping up with contemporary clinical practice through the colleges and societies and their recommendations. We also are promoting a cultural shift towards more is actually not always better. Sometimes the right test is no test. And we also become a learning organisation. So the more emphasis that we place on improving quality and safety and educating ourselves around better practices, the closer that we are actually getting to enhancing value in our pathology services. So our strategy is very importantly clinician-led. We've heard about the benefits of that from previous speakers. We actually have consumers at the centre of our concern, and we're really focused on providing quality pathology services. Those clinicians are supported by administrators such as myself and my team, educators and also pathology representatives. So it's very timely to also acknowledge Pathology Queensland representatives here in the audience, and they really are essential partners in our project due to their shared vision of reducing waste and unnecessary testing. So we really enjoy a great relationship with our laboratory colleagues, especially in the microbiology, anatomical pathology and transfusion medicine areas. Overall, our strategy is really about making the health dollar go further in times of increasing activity and resource use, whilst improving quality and safety for patients through reduced testing. Okay, in terms of the clinical approach for our project, clinical engagement is vital. We've heard that a lot today. That's how the strategy works. We've focused on specialties and service areas to look at their ordering patterns. We actually activate a whole lot of clinical working groups, and we target lead medical, nursing, allied health and business representatives and our pathology colleagues as well. And our team actually creates a profile of pathology use by a specialty or a service area. The clinicians then target key tests that they would like to review and manage that change in ordering behaviour that follows. So this approach to clinical engagement has really empowered those teams to create their own solutions and initiatives based on data as a way of embedding ordering culture changes. From there, the project team helps monitor and report the benefits to ensure sustainability. And our approach to clinicians was really framed by promoting wise choices. And really, the fact that we've engaged in this process quite authentically, we actually have had some cost improvements that inevitably have followed. The other thing we've discovered is there are some common tests that have fallen out of these clinical working groups. So we are developing some universal testing guidelines as well for tests such as C-reactive protein, blood cultures, full blood count and other infection control screens. In terms of demand management that I mentioned a little earlier, there are many ways to influence change at the clinical level, and just here are some examples listed. But obviously clinical audits and practice reviews help to gather evidence. Developing clinical guidelines and pathways for a specialty or service helps make sure that anyone coming into that team knows what pathology ordering is appropriate. We often activate quality and process control changes that might even be system changes, so changing an ordering palette in one of our systems so that we can debundle tests. Education, orientation, handover and training is extremely vital to make sure that those lead clinicians that we're dealing with can share those learnings amongst their entire team. We do a lot of performance analysis and benchmarking and research and evaluation as well, which is an area we really want to step into a little bit more seriously. In terms of the data approach, the project team has created a rich data set, and it really allows clinicians to visualise their pathology testing patterns along that patient pathway. So our engagement strategy really commences with analysing and profiling the pathology ordering behaviour within a clinical specialty or service area. We actually create this profile from clinical costing data, which probably many of you are familiar with. It's collected in every hospital, and that matches the pathology transactions with that patient pathway I was referring to earlier. What that does is it allows us to filter and review data across multiple dimensions. So really, instead of just saying, well, we ordered X amount of this test by Dr. X, we actually can have built a very powerful data set that reveals more valuable metrics. So with this rich data, we can also benchmark across our clinicians, across specialties, and even with other health services around the nation. The project team has also developed an interactive and dynamic dashboard to further maximise the opportunity for clinical teams to self-serve and to really look at their pathology ordering patterns. It's a very digestible way of showing that data, and I suppose it's a bit of a new, it's a new build for us. It wasn't previously available in the health service. So previously there was a lot of anecdotal thought about, we think we're doing too much of this, but we have no evidence. The dashboard has been designed to enable data discovery, performance reporting and trend analysis, and it also can get you right through to a layer where you can actually get audit lists, and that's been very helpful for our clinical teams. I've just provided a very brief screenshot, but in a live format, it's very dynamic. Sustainable change, obviously that's what we all are here for, to make sure that what we're driving is sustainable. So number one, we've got strong clinical involvement, and we are also, number two, informing that by data and business intelligence tools. So basically, we have reduced routine and repeat tests that really don't provide any benefit to our patients. That's it.
Go on.
Oh, okay, thank you. So basically, this has led to a 2% decrease in the number of tests being ordered, which equates to about 2,500 less tests each month, despite a 10% increase in patient activity. So remember on the first slide I said that there's a 5 to 10% increase in pathology work. We're basically defying those odds at Gold Coast Health. So our pathology ordering is going down while our activity is growing up. So obviously with reducing unnecessary tests, we are also saving money. So that allows us to treat more patients, and our consumers benefit from clinicians making wise ordering decisions. And we are really moving from value-based testing, where we scrutinise the tests to make sure they're useful for diagnosing and treating patients. So these are all the teams who we've engaged with so far, and some of the tests that we've actually created some changes with. Thank you for allowing me to share the experiences at Gold Coast Health. We're very interested to hear the insights and highlights from the other health services presenting today and professionals. And we're also keen to expand these conversations we've had in pathology into other areas such as medical imaging, blood and blood products and medications and so on. So thank you. Good day.